Welcome to Seven Rivers Sports here in La Crosse. I'm your host, Terry Erickson. Each week, an inside look into sports, wellness, and fitness. Well, today it's a special treat because on our set, Dr. John Morrissey set to retire after 27 years as an orthopedic surgeon at Franciscan Mayo Healthcare. Welcome to the show, Dr. Morrissey.
Thanks a lot, Terry. Glad to be here. Really an honor to be here.
Well, it's an honor to have you, no question about it. Mixed feelings? I know you're set to retire this summer. Did you know the time was right?
I think I knew the time was right. Things are just changing. Technology changes. My body's starting to break down a little bit, to be honest with you. You know, and things, smaller things that would not bother me in the past have started bothering me. So, to me, it was a fairly clear-cut decision. Yes, do I feel somewhat hesitant a bit, but I know it's time. I know it's time, and I'm gonna still work. I'm going to take some extra call for the next year or so. So I'm about 90% retired, I guess.
It's funny because I know a lot of physicians that have retired, and they have a hard time because maybe more than any other field, you are so submerged in your work, so dedicated to your patients, that making that transition is very difficult. Will it be for you?
I think it'll be somewhat difficult, but I've prepared myself for the last 2 years for it. I knew that I was going to retire about 2 years ago, and the decision was fairly clear for me. Will I miss it? Yes. Will I miss my patients? Yes. Do I think it's the right time to retire? And I would say yes. Having said that, I still think I'll be getting up early in the morning. You know, I still think I'll be going to bed early at night. I still think I'll be trying to exercise, do the things I normally do. But it's time. I mean, to me, it was a very clear decision, in all honesty.
You know, in my heart of hearts, I knew it was my time, too, and I never looked back. And I had an easy transition with all the things I'm involved in, as you perhaps know. One of them is 15 grandchildren, which keep Sue and I busy nearly every night of the week. But retirement plans for you?
I think similar thing. My wife Debbie, who's been, we're going to be married 40 years in August 13th. So she's been by my side my whole career, medical school, residency, military, here. And we're starting to have grandkids too. We have 5 grandchildren, and we still want to hang out with them while they want to hang out with us. So I think La Crosse is going to be our home base. We'll spend the majority of our time here in La Crosse. We have a place in Colorado that we'll spend some extra time, but I don't think we'll spend like months and months and months. So we'll do some traveling. We've traveled a lot already, so we feel pretty satisfied there. But we'll spend some time in Colorado. We have a daughter in California we'll visit. We have family in Arizona. We have family in Chicago. We have our place in Colorado. We have family in Florida. So we have good places to go, you know.
Well, you got a busy destination. The airlines are going to love you. So speaking of family, I know your wife and know your whole family. We'll talk a little bit about that. But unlike many physicians, and I'm certainly not an expert on this, but physicians have a hard time finding balance in their life. So many of them, maybe better now than in the past, but so many of them totally submerged with their work. Their family suffers. That's not necessarily been the case with you.
I don't think so. Orthopedics is a very busy specialty. You know, we take a lot of call, and generally when we're on call, it's very busy. Having said that, there's generally been in my career at Franciscan Mayo 4 or 5 orthopedic surgeons. And so it basically ended up every 5th night and every 5th weekend on call. Not too bad, pretty manageable. Still very, very busy. I would say, though, we have 6 children. I would honestly say that I never missed any major event that they had, whether it be graduation, church things, sporting events. I may miss a few games here and there, but we've never really missed a vacation that we wanted to do. We've never missed major events, never missed anything. So I felt I had a balance.
You know, that says a lot about your priorities, and that's extremely admirable. Can we take a quick trip down memory lane? Growing up in Chicago, I know, must have been eventful, and then Rockford as a basketball and baseball All-American athlete, and then on to medical school.
Correct. Correct. Yeah, I grew up Oak Lawn, which is southwest side of Chicago, southwest suburb. So I'm more of a White Sox fan than a Cubs fan. Still pull for the Cubs, but more of a White Sox fan. Knew early on that I wanted to be a physician, probably by the time I was in 7th or 8th grade. I don't really know what influenced me. I think maybe going to my family doc, I just found that very, very interesting. So I knew early on that way. Met my wife in high school. We were high school sweethearts. And played basketball and baseball, through the years in childhood. Went to Rockford College, which is now Rockford University. That was an NAIA school at the time I went, so I did get a scholarship because they didn't have to really follow the NCAA rules. So I did get a scholarship, a combination of academic and athletic, played basketball and baseball. And honestly, did not have much debt. And then got accepted to Northwestern Medical School. That was in 1977. Had the Army pay for my medical school. So joined the Army. That's called the Health Profession Scholarship Program. The trade-off is then after medical school, I had to do my residency in the military, which was from 1981 to 1986 at Fitzsimmons Army Medical Center outside of Denver. And then I had a 4-year payback at Fort Sill, Oklahoma. So in the midst of all that, we were kind of raising our family. My wife stayed home with the children. We were fortunate enough to have that happen. And, I just went through my training and my payback, which was 4 years. I left the Army in June of 1990, right before Desert Storm. So my timing was very lucky and very impeccable. And we honestly thought we would move back to Chicago. But Chicago seemed very busy. Orthopedic surgeons were working out of 4 and 5 different hospitals, taking call out of 4 and 5 different hospitals. We found La Crosse. I knew La Crosse from Old Style beer.
So that was your attraction, huh?
Well, my dad used to like Old Style beer, and at the time, back in the 60s and 70s, and Old Style beer was big in Chicago. So found La Crosse, and we liked it, and, one hospital, one health system. Yeah. It was perfect for us.
So in 1990, the call comes, and you're in La Crosse, and then 27 years later, you retired. But you had quite a career leading up to that, prepared you for that, and then of course with 6 children. And one thing I found out recently too, one of your children, Katie, now Katie Hansen, is your PA. So what a joy that is.
Oh yeah, I think that's incredibly blessed. I'm incredibly blessed to have that. Katie's our oldest daughter, was always a star student, always kind of the mother figure with all the siblings. And the typical PA, the physical, physician assistant, second career, some of the more mature, older ones. Now it's becoming more of a primary career, but in Katie's case, she went to University of Minnesota, went into education, thought she might go into medicine, but ended up going into education, taught for a few years, had her master's degree, decided, maybe I'll try this. So she went to Augsburg University, got her PA degree, and at the time we were expanding at Mayo with a bunch of physician assistants and nurse practitioners, which is one of the things that has changed a lot since I started, is the arrival of associate providers. So when I started at Mayo, at Schem Clinic, then we had maybe 1 physician assistant. Now between the PAs, the physician assistants, the nurse practitioners, the nurse anesthetists, there's 70, 80 of them. And Gunderson is the same way. So I am incredibly blessed. I think I've worked with Katie for the last 7 or 8 years. She's truly an extension of me. How many dads can say that they see people, important parts of these people's lives in clinic and in the operating room? She's my first assistant in the operating room, and on call, she's my first assistant. And how many people can say they share those important moments in people's lives on a daily basis with one of their children?
Very few. So just bouncing to what I was going to conclude with, let's go to it right now. So perhaps one of your legacies is just that, training and having her work side by side with you.
Oh, for sure. And she's going to continue on. When I leave, she'll still be there and part of the orthopedic clinic. She'll still be seeing a lot of the patients we jointly followed. And they look at her as an extension of me because she's my daughter, you know. Not many dads can say that.
Well, when you walked into the set today, you have 5 daughters and 1 son, Lucas, who I know quite well. And you have the exact same gait that he does, watching him play at Aquinas, Eau Claire, and then fortunately coming back to UWL, playing, and now a successful businessman and an assistant basketball coach with the Aquinas Blue Gold girls. What a treat. Before we go to break, talk a little bit about a treat watching him as a Blue Gold athlete.
Oh, for sure. I think people who remember Lucas, a very, very good athlete. I would like to say that he inherited all that from me, but my wife was a good athlete too. And you know, Terry, I mean, what we did when we played basketball and baseball, kids these days are doing it in 8th grade. You know, we thought was fancy and really great stuff when we were in high school or college. I mean, kids are doing this 8th grade, freshman year, stuff like that. Lucas has always been just a really nice kid, an overachiever, a really good athlete. And particularly in basketball, you know, he saw the court well. I mean, he was a team player. I mean, he did a lot of really impressive things in his career.
He did. And I said more than once on this show and on broadcast that Lucas was more important to the state championship team, the Blue Goals, as a senior. Throughout his career, actually, I think he was the best athlete on that team, and it showed at the Kohl Center. So, you and I agree with that point.
I agree with that. And honestly, all my children, from Katie, who's the oldest, Lucas, the youngest, were very good athletes. You know, we had volleyball players, we had softball players, we had tennis players, we had track athletes. They all were very, very athletic.
Good. Well, we're going to step aside just for a minute. When we come back, more with Dr. John Morrissey right after this.
At Schneider Heating and Air Conditioning, we have assembled a championship team
who listens to what your needs are.
We install carrier comfort systems that improve the comfort, efficiency, and the air quality of your home and workplace.
We serve you with highly trained technicians who are prompt, friendly, and honest.
For Gold Star treatment, turn to the experts, Carrier and Schneider Heating and Air Conditioning.
Schneider Heating and Air Conditioning, your comfort is our business.
Welcome back to Seven Rivers Sports. Again, our guest today, Dr. John Morrissey, set to retire after 27 years at Franciscan Mayo. Well, in the second half, we're going to break down a little bit the orthopedic surgeon and what it's all about. And first of all, I know things have improved over the years, but in 1995, and you were part of that, the affiliation connected between St. Francis Hospital and Mayo. So now it's called Franciscan Mayo Healthcare. And obviously that was beneficial for you, physicians and patients.
Oh, for sure. When I started in 1990, which was then Schem Clinic, and people who lived here for many, many years know that Schem Clinic was generally a primary care clinic with some subspecialty and specialty surgeons. So the majority of this was primary care, and then Gunderson was more specialty care. And I think over the course of those 5 years that I was here, it became pretty well understood that to survive in the changing environment, we needed a little bit more oomph. And I remember sitting at several meetings in 1995 because, in all honesty, we were thinking of joining, there was a thing, maybe we would join Gunderson. Mayo. Mayo at the time was starting the so-called Mayo Clinic Health System, the model where they had the 3 medical centers, Rochester, Jacksonville, and Scottsdale, and then they would buy out hospital systems around there, so as referral centers. And I even think Marshfield Clinic was in the mix at the time, and we had meetings, because at that point we were shareholders in the clinic. And so there were some antitrust issues with the Gunderson type situation, and eventually we went with Mayo. And I don't think the physicians who have been there a long time and the ones who have since retired, for us, I think that was a great decision.
But there must have been some reluctance, losing your identity, maybe with the Franciscan Sisters and all the stakeholders. Right. There must have been some reluctance.
There was a lot of reluctance. I mean, and there was a lot of other things that I don't know about that went on in discussions, because it was a combination of, and it was kind of a loose association at first, but it was a combination of the clinic had to join the hospital, because really those were two separate entities. So Skem Clinic had to merge with St. Francis Hospital, and then we had to merge with Mayo Clinic. And then there's the whole Catholic issue, you know, in terms of what we would be able to do, what we wouldn't be able to do, all that kind of stuff. And that was a new thing with Mayo as they were expanding.
The original definition of orthopedic surgery is prevention and correction of injuries and disorders of the skeletal system, injuries that are expected, unexpected, prevention, more control, and so on. Has that definition changed?
You did your homework, Ted. That's really good. You're exactly right. Orthopedics classically means to straighten the child, you know, so ortho and pedia for pediatrics. So classic orthopedics was straightening limbs of children. Scoliosis, which is curvature of the spine, club feet, for example. And it's expanded through the years now to sports medicine, fractures, hand surgery, you know, all kinds of various things. So I'm a general orthopedist, so we take care of most everything that comes through the door. In my career, I initially included spine in that, but I haven't done spine surgery for many, many years. We have two excellent neurosurgeons at Mayo now here in La Crosse, and they take care of the spine stuff.
You know, in some of my readings, I found the father of orthopedic surgery was a physician from the UK, Robert Jones, and he was involved in World War I with reconstructive surgery and just sort of pioneered some things along the way, and the evolution of that, of course, and the sophistication, the technological advances, and so on. But 50 years ago, surgical reconstruction was not even talked about, and now, of course, it is, especially in the advanced world, wealthy societies like ours.
Right.
So let's quickly talk about the advances since 50 years ago.
Sure. Well, I would say if you asked any orthopedic surgeon, I think to a person, if you had to pick one thing that has changed the lives of millions of people from, say, the late 1960s to now, would be total joint replacement. Total hip replacement, total knee replacement, total shoulder replacement, that kind of stuff. And the father of total joint replacement was also a British surgeon named John Charnley, Charnley. In the 60s, he started total hip replacement. So when I started medical school in 1977, really the only total joint replacements that were being done was total hips. We were just starting to do total knee replacements. And then it's expanded from total hips to total knees, total shoulder replacements, elbow replacements, ankle replacements. Before that, if you came in with arthritis in a hip, you would either have just your hip taken out, the ball taken out. That's called a girdle stone procedure, and the femur would just articulate with the pelvis. You wouldn't have a joint. Your leg would be shorter by 2 inches, but you wouldn't have a joint. Or your hip would have to be fused, where you stuck the two bones together. So that's probably the biggest surgery, biggest advance that's been done from when I started till now.
Here's an interesting revelation, something that just stunned me when I did some research for this week's show, and the fact that the sophistication, the advances in this country, but that's not the case in third world and developing countries, where 90% of the fractures that occur in this world are in third world developing countries. And that's where orthopedic disease is on the rise in those low income, moderate income countries. And for example, in Ghana, there are 24 orthopedic surgeons in that country, compared to 24,000 in this country. So with all that across the ocean happening in these developing countries, how are we contributing? How are we assisting those countries?
Well, number one, by research, okay? Number two, our medical schools and residency programs are accepting physicians from other countries to be trained here. Number three, there's lots of orthopedic organizations that do wonderful care overseas. Orthopedics overseas, Doctors Without Borders, all those things. But it is just, even in our own country with homeless people and things like that, but other third world countries, it just starts from infancy. You know, those kids are born with club feet, congenital scoliosis, neuromuscular diseases like cerebral palsy and stuff, and there is nobody to take care of them. There's nobody to treat those people, and it just starts from there.
Isn't that a sad statement?
It's a very sad statement. It's a very sad statement, but it's the way it is in a lot of those third world countries. And then if a person gets an infection, an infected hip or a joint, if they're not treated, it's ultimately a fatal disease. Fracture care, there's probably people who are walking around with fractures that were never treated. They're malunited, they're not united, you know, they haven't healed, things like that. So a lot of countries don't even get basic orthopedic care from childhood on.
Let's take a quick look. I know that forecasting the future is sometimes difficult, but we talked about the evolution, but let's just step forward like 30, 40, 50 years and what you think will be the change, the evolution of orthopedic surgery.
I think a couple things. I think as time goes on, we'll have more and more orthopedic surgeons. I still think there's going to be a shortage of orthopedic surgeons. Hence, the importance of the so-called associate providers, physician assistants, nurse practitioners, people who can do probably 90% of what an orthopedic surgeon can do short of surgery. So in other words, those associate providers can treat a lot of things in third world countries, for the homeless people here in the U.S., for people who don't have access, they just can't have the surgical care. But probably 90% of things can be treated adequately by them. So I think in the future, you're going to see more and more associate providers in all specialties, not just orthopedics, coming to the rescue, because no matter what, even 50 years from now, there's not going to be enough doctors to treat all these people.
Tips, and a lot of people are probably wondering this, and me as a weekend warrior and still thinking he's an athlete. Tips for the weekend warrior, the baby boomer like me.
Okay, I would say this. My honest thought process is that with social media, it is so ingrained that people have to exercise so much every day, and we see overuse injuries all the time. So I
think he's talking to me.
Right. So in my view, if you're over the age of 50, for instance, I would say you can exercise moderately 1 hour, 1.5 hours, 3 or 4 days a week. You should take time off every other day. And you should cross-train too. You shouldn't do the same thing day in and day out. But I see people who try to do too much. I mean, no matter what, you're going to get older, you know, and your body's going to break down if you overuse it. So I would say what we see a lot in the weekend warrior, the 40s and 50s people, is they're doing too much, in all honesty.
Okay, well, that's good advice for me. Mm-hmm. I talked to somebody from Franciscan Mayo today, and here's what they said about you. We want to thank Dr. Morrissey for his years of service, his enthusiasm, his expertise, his devotion and dedication and care for his patients. Highly respected physician in our system since 1990, and you received a Lifetime Achievement Award recently from your resident education. You are leaving a huge void in this community with your retirement, and you are. Everyone I talk to that you have worked with has nothing but just incredible compliments about who you are and your and how gifted you are.
Well, that's nice. I mean, that's what can I say to that? I can look my patients in the eye and say that I really think through the years I did the very best for all of them. Having said that, as you know, in sports, it's a team game too. I can't say that I did all this on my own. You know, I had my family's support, my wife's support. You know, there's wonderful people working by us and at Gunderson and all kinds of places, wonderful nurses and therapists, you know, and medical assistants and associate providers and all kinds of people. It's a team game. I mean, I'm part of it, but I'm not the whole part of it. You know, and I appreciate the help of all those people.
Well, there's an old saying, the speed of the leader determines the rate of the pack. Mm-hmm. And my coach used to say that all the time. But one last thing, too. With all the knowledge you've accumulated over the years, any thought of, I mean, taking that and not using it, is that a sense of a real concern? I mean, couldn't you be doing something in terms of writing or teaching?
I have thought about the teaching part of it. I've not really thought about writing too much, but I have thought about doing some teaching. You know, I enjoy that. We have a family residency program at Mayo here, and the residents regularly rotate through orthopedics. We get the PA students from UWL. We get those, and you know, I've thought about that.
So we found a second career for you.
Maybe a second career at some point.
All right. Well, listen, it's been an honor, and I know you probably have to go back to see patients, but spending some time with us is one of the highlights of the summer. So thank you, Dr. Morrissey.
Thanks for having me, Terry. I mean, it's been a good ride. I'm ready to retire. I want to thank everybody for all your wonderful support, and just had a good career.
Well, thank you. So we'll be back with some closing thoughts right after this.
At Schneider Heating and Air Conditioning, we have assembled a championship team
who listens to what your needs are.
We install carrier comfort systems that improve the comfort, efficiency, and the air quality of your home and workplace.
We serve you with highly trained technicians who are prompt, friendly, and honest.
For Gold Star treatment, turn to the experts, Carrier and Schneider Heating and Air Conditioning.
Schneider Heating and Air Conditioning. Your comfort is our business.
Welcome back to Seven Rivers Sport. The spotlight today on Dr. John Morrissey as he retires after 27 years as an orthopedic physician with Franciscan Mayo Healthcare. Well, check your local listings as we continue to bring you Knights of Thunder Racing every Thursday, every Sunday night at 7 p.m. Thanks for joining us this week. I'm your host, Terry Erickson, hoping you will have an active and a